Carmen.
Hi.
Hi, my name is Erica. I'm a student nurse, and I'm going to be performing a head-to-toe health assessment. Are you okay with that?
Yeah.
Okay, perfect. I'm gonna hurry and do some hand hygiene real quick. And while I'm doing this, can I look at your ID band? Can you confirm your name and your birth date for me?
Carmen Patino, January 8th, 2000.
Perfect. That's in my records, so that's good. You're the right person. All right. So, just gonna get some gloves on here. Do you have any past medical history or surgeries or?
No.
Okay. No allergies to medications?
No, only to the pollen outside.
Okay. And then, yeah, maybe I need to do these small. Sorry. Alright, have you had any past surgeries?
No.
What are we seeing you here today for?
My knee hurts a little bit.
Your knee hurts a little bit?
Yeah.
Okay, perfect. Can you rate that pin for me?
A 3.
About a 3?
Yeah.
Okay, so not too bad.
No.
Cool. And since you're an adult, I'm using the 0 to 10 scale, pain scale. This assesses, your level of pain. If you were a child, I would do the faces, or if you were nonverbal, or you were, too young to, or a newborn, or too young to do faces, then I would use the flag scale. So to assess this, we have an acronym called COLDERA. So the C stands for characteristics. So is there any pain, or sharp pain, or dullness, or
Sharp pain.
sharp pain? Okay. Onset is the O. When did this happen?
About 3 weeks ago.
About 3 weeks ago. Oof, that's not good. Let's see. L is the location, which you said your knee, right? Okay. And then D stands for duration. How long has this been going on? Or how long does it last?
Usually a couple minutes.
Okay. So with exacerbation, is that when you stand up, or when it makes it worse, when you walk around? Okay. Is there anything that relieves your pain?
I'm just not moving it.
Just not moving it? Okay. Does it radiate anywhere?
Up my leg a little bit.
Up your leg a little bit? Okay. And then A stands for associated symptoms. Do you have any nausea or dizziness
No.
with that? No? Okay, perfect. All right, I'm going to assess your LOC, your level of consciousness. Can I have you state where you're at?
At Snow College.
Good.
West Campus.
And you already said your name, so you know who you are, your person. Do you know what time it is?
Not the time, but I tell you the day of the week.
Okay,
It's
perfect.
Tuesday.
It's Tuesday.
Yeah.
Okay. All right. You are oriented times 3, so because you can name the time, the place, and your person. So that's really good. Next, I'm going to assess your pupils and see how they react. This is part of the neurological assessment. All right. So I'm just gonna have you look straight at my nose, and then and normally I would turn off the lights, but I'm not going to for the purpose of this test. But I'm gonna look at the reaction to your pupils. Good. Good. Okay, those are equal and round. All right, now I'm gonna hold this pen light out, and I want you to just kind of look at the tip of it and follow with your eyes. Okay, good. And then I'm going to go in like that. That's called accommodation. So everything looks great. I checked your perla, which means your pupils are round, they're equal, they're reactive to light, and accommodation, which is this fun little exercise. You seem like you're in a good mood, and so your mood is good. You're interacting with me, and which is really good. And you're able to communicate. So now I'm going to have you smile. Good. Your smile is equal. It's not unequal, so that's a good sign. And you've been able to talk to me, which is good. So you haven't had any slurred speech that I can recognize at this moment. And you don't have any droopiness, so in your face or anything. So that's great. When I came in here, I did a general safety check around the room, and I made sure you were safe and that the room was safe as well. And while I was walking in, I assessed, and I didn't see anything of like any tubes or catheters, oxygen tubing. If I did, I would assess the IV site if you had an IV, and I would check the flow rate. I would check for patency in the IV and the location, and make sure there was no redness, no skin issues around there, no odor or drainage or anything like that. And then, so I'm going to start with the integumentary system. So I'm just gonna fill your extremities, and then I'm gonna fill your pulses, and then while I'm palpating your extremities, I'm going to feel for tenderness. If there's any tenderness, if there's pain associated with that, I'm gonna check the temperature, and then I'm gonna also check the skin integrity as well of it. So, yeah. Are you okay if I lift this up?
Yeah, that's okay.
Perfect. I'm gonna look at your arms, and I don't see any redness, so that's good. And the temperature is warm. It's good. It's not pale, and there's no bruising or anything. It's not tender, is it? No. Okay. Perfect. Good. I'm gonna check this arm now, and that's good as well. Everything looks good. Okay. All right, I'll pull this down for you.
Thank you.
Yep. All right. So now I'm gonna check your capillary refill, and so that's just I'm gonna press down on your fingernails, and if it comes back within 3 seconds, the color comes back within 3 seconds, you're hydrated and you're getting good blood flow and everything. So that looks good. 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 Okay, other hand. Good. That looks good. Looks good. 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 Perfect. You're pretty hydrated, it looks like. But I'm also gonna check another spot to see if you're pretty hydrated, which is I'm assessing for turgor. So I'm just gonna kind of pinch right here, if that's okay.
Yeah, that's fine.
Just right under your clavicle, and the skin bounces back like it's supposed to, so that's a good sign as well. So now I'm going to feel your facial structures and see if there's any abnormalities. I'm going to just kind of assess the structures and everything there. So I'm just kind of feeling your head. There's no tenderness, there's no swelling, just sinuses are good. There's no lip no swelling under the neck, so that's good. Okay, so now I'm going to, with my pen light, I'm going to check your ears, your nose, and your throat, and kind of assess for any kind of drainage, redness, or swelling, all that
Sounds
stuff.
good.
So I'm gonna look in your right ear first. Looks good. There's no swelling. It's not red. I'm gonna check in this ear as well. There's nothing to be concerned about. Okay, I'm gonna have you tip your head back a little bit. Okay, everything looks good. No drainage or anything. I'm gonna have you stick out your tongue for me. Okay, and your throat looks good. And there's no redness or swelling, no nasal drip, and everything looks good. Stone drainage, so, and there's no halitosis, which is good. Okay, so now I'm going to have you lay down. I'm gonna listen to your heart and your lungs, and so I'll have you lay down here. All right. So first of all, can I check your chest and make sure there's no redness or
Yeah, it's
anything
fine.
like that?
Go ahead.
Okay. All right. Everything looks symmetrical, and that's good. And there's no redness, no rashes, or anything of that nature. Are you having any chest pain?
No.
No? Okay, that's good. So I'm gonna actually listen to 5 different points for your heart. I'm gonna listen to your aortic, your pulmonic, Erb's point, tricuspid, and your mitral valve.
Oh.
So I'm gonna listen to your aortic, which is right here. Sounds good. Okay, I'm gonna move on to your pulmonic. That sounds good. Okay, I'm gonna check for your Erb's point. Good. Okay, and then tricuspid, I'm gonna come down here. That sounds good. And then I'm gonna listen kind of long on the mitral valve, which is at the point of maximal impulse, or the PMI. And I'm just gonna listen for rhythm and for heart rate. I have time about 30 seconds or so. Just enough to listen to the heart rate and rhythm. Okay, that sounds really good. Your heart is strong. I don't hear any murmurs or anything like that. I can hear the S1 and S2, and so that's good. That's a good thing. All right, now I'm going to assess your chest again, and I'm gonna look for your breathing and make sure it's you're breathing correctly and it's symmetrical. So I'm gonna go ahead and do that. That looks good. Okay, do you have any chest discomfort when breathing or any cough?
No.
Okay, nothing makes it worse. Okay, perfect. So I'm gonna listen to 6 different spots. The anterior side, which is the front. I'm gonna listen to 6 different spots there, and then after I get listening to the front side, I'm gonna have you sit up, and then I'll listen to the back at 6 points as well, the posterior side. So as I'm doing this, just take some deep breaths for me, in and out, and let me know if you have any dizziness or discomfort or anything. Okay, and I'm gonna listen to each lobe. So I'm gonna go right here under the clavicle, which is the first part of the lung. Deep breath in, out, good. And I'm gonna go from side to side, because that will allow me to compare your lungs from one side to the next. Okay, I'm gonna move down to here, a few inches. Good. Okay. Good. Okay, now I'm gonna listen down here. Good. I'm gonna listen to this side as well. Good. Okay. Now I'm gonna have you sit up, and you need some help. Okay. Awesome. All right. Now I'm gonna listen to your breath sounds on the back side. As I'm listening, I'm going to assess for any crackling, any wheezing, any whistling, or any abnormal sounds. And I didn't hear any on the front side, so that's good. You doing okay?
Yeah.
Okay. All right. Good. Okay. Good. Okay, I'm gonna move down here. Good. Good. And last spot. I'm gonna straighten that out a little bit so I can hear it. Okay. Breath in. Oh, good job. And one more. Perfect. Your lungs sound great.
Good.
There's no abnormalities that I'm hearing, so that's a really good sign.
Good to hear.
All right, and I'm gonna change my gloves, and I'm going to assess your feet now, and your legs. Oops, there we go. I'm gonna do some hand hygiene. Still no questions?
No.
Okay, good. You're doing great. We're almost done here. Alright, before I move down to your legs, I'm going to feel your your pulses in your wrist. And then I'm also gonna have you grip my fingers.
Okay.
So just grip as tight as you can. Okay, good. Alright, now I'm gonna feel your pulses. Okay. They're both good. Equal bilateral. And now I'm going to feel your legs and make sure there's no swelling or edema. Like I said before with the arms, but no edema is felt or anything. Okay, and the skin looks good. The skin integrity looks great. And on this side as well. There's no tenderness?
No.
Okay, good. Okay, perfect. Now what I'm going to have you do is I'm gonna put my hands on the bottom of your feet and press down like a gas pedal. Perfect. And then I'm gonna have you push up on my feet, my hands. Perfect. Your grip strength is good. So now I'm gonna have you lay down one more time and I'm gonna assess your abdomen. I'm going to check your bowel sounds. So is it all right if I lift up your shirt a little bit? Okay. okay. That's all right. Perfect. Got it?
Yeah.
Okay. Okay. I'm just gonna pull it up a little bit, just enough to get to the 4 quadrants that I'm gonna be assessing. Looking at your chest, I don't see, or your abdomen, not your chest. I don't see any problems. There's no swelling, no bruising, no protrusion of the stomach. So what I'm going to do now is I'm gonna listen in all 4 quadrants. So I'm gonna listen for about 15 to 30 seconds and listen for that bell sound.
Okay.
All right, the first quadrant. Okay, good. I'm gonna move up to the first quadrant here. Good. And then the third one. Perfect. And the last one. Okay, now I'm going to fill a 5th point, which is a bruit, or listen for a bruit, not fill. And it'll be right here.
Okay.
And that sounds good. I don't hear any bruit, so that's perfect. All right, so I listened to all 4 quadrants, and I also listened in the 5th for your bruit. So now I'm going to fill. Let me know if there's any pain or discomfort. Good. Nothing wrong there. That feels good. Okay, perfect. All right, I'll help you take this down now. Give you some privacy. All right, how has your bell been? Have you, are you regular?
Yeah.
Okay, good. No pain or discomfort?
No.
Okay. And when was the last time you had a bowel movement?
Yesterday.
Yesterday? Okay, good. Also, here, can you tell me about your urine? Is that normal color, no odor, no drainage?
Yeah, normal.
Okay, perfect. And when was the last time you peed?
This morning.
This morning, perfect. Okay, all right. And when I came in here, I did shut the door and I provided privacy for you. And I'm trying to think if I missed anything, so just bear with me for a second.
No, you're good.
I assessed your head and your facial structures. I tested your ears, your nose, and your throat. I looked at all your skin, and everything looked good. And I felt for the pulses. Oh, one thing, I actually did not feel for your pedal pulses or your tibialis pulses. So I'm going to do that right now. Are you okay if I take off your socks?
Yeah.
Okay, perfect. All right, so tibialis pulses are good, bilateral. Now I'm gonna come in here like a V and feel your pedal pulses. And that's good. Okay, they're both equal. So that's good, and I don't see any skin issues on your feet. Okay, perfect. And I checked all your extremities. Everything looks good, and I've assessed your bowel. I heard it, I looked for it, I felt it, and everything seems great. So, do you have any questions for me?
No.
Okay, awesome. I'm gonna take off my gloves and do some hand hygiene. Here's your call light, and your water's right here, full. And your bed is at the floor already, because I'm not very tall, so didn't have to do much. But normally, if I was taller, I would lower you down to the floor. And you don't have any oxygen, there's no tubings or anything like that, so no interventions or anything that we have to go over with that nature. All right, thank you for letting me do this for you.
No, thank you.
You're welcome. Have a nice day.
You too.